Finally, I would like to focus on the point of view of users, and for that we're counting with Afuera. She's a political scientist with experience-based knowledge on the drug policy field for more than 10 years. She is an executive committee member of ENCOT, and currently she is coordinating the political group of the Confederation of Cannabis Social Clubs in Spain. Ana, yours is the floor.
Hello. First, I want to thank the organizers and especially Dianova for inviting us to this side event and giving us the opportunity to participate in the study presented here today. From users' organizations, we defend the people's right to consume substances for recreational and therapeutic purposes, with all the information available and knowledge about doing it in less harmful ways. Each substance has a context of consumption and methods of cultivation or supplying, and all those steps contain harm reduction concepts. After 60 years of international prohibition, there is no evidence of a decrease in the demand. Cannabis is and will be a plant of regular use for humans. Consumption of cannabis for recreational purposes is a reality that will not disappear. Additionally, the human body has a specific system to detect cannabinoids. The endocannabinoid system is not hosted in any vital organ, and no one has ever died for phytocannabinoids. The only deaths reported have been from synthetic cannabinoids. Authorities and agencies should separate one from the other concept in data collection tasks to make a more reliable landscape. In the information society, people adapt their perception of risk to the tangible harm of the substance compared to other substances like sugar. We must approach each substance for what it is and the real harm it could provoke, but also for the benefits it could have in aspects of people's well-being. In a balanced approach, without banalizing because of the risks, and also without demonizing or creating alarmism. The last indicator signals the increasing consumption in developed and accommodated societies. For example, in Europe, there is an increment in cannabis use. Cannabis is a bellwether issue for drug policy due to its low toxicity and its high use prevalence. And there is an increasing public interest attitude about its use. Using data from the EMCDDA, in 2018, more than 20 million people used cannabis in the European community, and more than 90 million reported lifetime use. The treatment entrances were around 135,000 people in all the European countries reporting to the Reitox network. Then less than 1% of people who are using cannabis are demanding this kind of service. It is a fact that there is an increasing demand for those services. Treatment entrances for cannabis are higher yearly, while states use this tool as an alternative to punishment, even for possession of small quantities applied to non-problematic uses. Therefore, it is not a sincere relationship with users and should be reinforced by empathy with attractive and effective services in a holistic approach. The strategies followed regarding decreasing of demand were not working at all. Then harm reduction also has to re-scope the care of the existing demand, with the responsibility of teaching users to consume in a less harmful way. Humanized services and care through peer relationships and non-stigmatizing perspective is a crucial point to take into account. All our demands talk about adult use. So our proposals are strict concerning minors. Policymakers should tackle this issue, trying to create prosperous lives, generate enthusiastic futures, and provide opportunities for young people. In this regard, it is essential to fight against inequalities and stigma. About other vulnerable populations, people with cardiopathies or mental health serious problems, the doctor who treats the patients with these pathologies should advertise the side effects of consuming cannabis, as well as the contraindications of possible prescribed medicines should include these incompatibilities. In the context of adult use, all pleasures can be associated with risks. Thus, such mechanism is a tool present in our daily lives, applied to food or legal drugs. Therefore, the knowledge on self-management of pleasures and substances and their effects is a challenge in immediate and abundant societies. It is unavoidable to point out that the worst side effect of cannabis use is associated with the most common way of consumption, the inhalation of the result of combustion from burning the plant in the form of cigarettes, spliffs. But most of times they mix cannabis with tobacco, the so-called joints. Then harms associated with smoking are usually associated with cannabis use. Everybody more or less is taking care of their health. And as much information someone has, more accentuated is this attitude, even among smokers. Working on recommendations about the least harmful ways of cannabis use, such as vaporizing or ingest, is a good starting point from a preventive approach. But some users do not want to quit smoking. It could be relevant for them to get advice about topics like filters, cannabis mixed with tobacco, and conductual preventive actions. This last could include recommendations such as the no association of daily life activities with smoking, trying to find context to consume safer, or responsibly regulate the cannabis quantity in the joint. On that point, the collaboration of activism and harm reduction entities is a fundamental factor for improving services and bringing positions closer by putting people, their rights, and their health at the center of cannabis services and programs. As an innovative concept to enhance harm reduction, we can find the Cannabis Social Club model, which is also a tool for substance control. Valuable learnings we can extract from this model are the possibility to implement evidence-based practices in safe places for consumption by accessing the target population, where they can share experiences and avoid the invisibility of consumptions. Then, the access to a quality substance with information and knowledge about identification of plaques or bad conditions of the cannabis samples. It allows us to eliminate practices such as adulteration and promote healthier cultivation methods by knowledge about fertilizers, contaminants, and pesticides. At this point, the model allows us to implement environmental and sustainability issues regarding cannabis cultivation. Then, once again, these spaces demonstrated even more usefulness during the pandemic, having habilitated places for access to the substance and being capable of guarantee security measures to prevent the spread of COVID-19. Finally, we would like to point out that cannabis regulation is a mandatory agenda item for the member states in the next decade, and the harm reduction entities' expertise, combined with the activism lessons, is an essential element to develop a humane drug policy. You can find more information about drug policy and harm reduction from the user's point of view in ENCODE website. And thank you for your attention.
Thank you very much, Anna. Thank you also for the concrete recommendations you provided. So let's move on quickly to the questions and answers. I will combine those with the ones remaining in the chat. So there is one question from Catarina Isabel da Paiva saying that there are many studies of the effects in young people. In adults, can you indicate studies that defend the reasons not to use cannabis and why? In this age, are there any idea that this is a plant and it's not harmful? So does anybody want to respond to this question? Yeah, Antonio?
We have a problem with the concept adult people. If we are talking about 18 years, we have to say from 18 to 24, 25 years, we can find several studies that can defend that cannabis can be a big problem for the people in development. If we're talking about legal age, as happened, for example, in the proposal of Portugal, or in the assessment and the monitoring that has been done in Canada, they are detecting that the increase of problems in adult people between 18 and 21 years, especially people that not only for the use of cannabis, as I said in the presentation, the problem is not only the use of cannabis. We don't have enough predictors of addictive behavior. We don't have enough predictors of being use of cannabis, enough predictors of other kind of mental problems in people, family problems in people. But what we know is that between 18 and 21 years, the use of cannabis can increase the risk to suffer a mental problem, as not only psychotic problem that is the obvious, but also mood disorders and anxiety disorders. So we have to be very careful when we're talking about adult people, because it's true that for the people that start to use of cannabis age older than 21, the number of this kind of psychiatric disorders decrease. But it's true that there is one very risky moment that is considered adult people that is still a risk. So that's why a few of those law proposals are trying to increase the age, as Heidi said perfectly in the presentation, is considering that adult people is over 21, not over 18.
Thank you. Yeah, I see Anna. Do you want to also? Yes, please.
Yes, I just want to point out that I agree with the development of the brain and all that stuff about young people. But if you can drive a car and die for that, and you can go to the jail, you are able to decide if you can or not can consume. And then, for example, in the regulations, we can implement these kind of tools to advise to young people. For example, in Catalan regulation of cannabis social clubs, we include specific programs for people from 18 to 21 and less quantity that they can get in the cannabis social club. Yes, so we can manage other issues in this part of age. Yes, but we cannot forbid, because they gonna go to other place with less guarantees to acquire the substances. So we have to take care about that also.